Researchers across the country, including in your area, are conducting a study that could include you or people you know. CAVALIER is a study that will look at whether giving calcium, vasopressin, or both earlier will increase survival for someone who is injured and bleeding badly. Both calcium and vasopressin are already widely used across the country, but usually later in a patient's care. Researchers think that giving these products closer to the time injuries occur could save lives. Typically, patients who lose a lot of blood and are given blood products have low levels of calcium and receive calcium later in their care to help their blood clot. Researchers think that giving calcium sooner may be better at lowering the risk of death. Likewise, when patients lose a lot of blood, their blood pressure drops. Drugs called vasopressors are given to patients to squeeze their veins to increase blood pressure to a healthy level. Researchers think giving vasopressin early could improve the chances of recovery in patients who have life-threatening injuries with a lot of blood loss. In CAVALIER, patients may be given calcium by emergency medical personnel before they arrive at the hospital, vasopressin after they arrive at the hospital, or both. Regardless of what patients receive for this study, patients can still get calcium or vasopressin later in their care if they need it. A randomization process, like flipping a coin, is used to determine if the patient will receive a study drug or placebo in addition to their usual care. A placebo is not a drug. The study drug and placebo look identical to remove any bias, but a plan is in place to give the doctor that information quickly if needed. Researchers will compare if one or both study drugs help patients to recover better. Researchers may do a blood test and will collect information from medical records as part of the study. Because treating blood loss is an emergency, there may not be time to get consent before being entered into the study. Patients may be too severely injured to give informed consent, and families may not be immediately available. As soon as the patient or their loved ones are available, researchers will notify them and give them detailed information about the study. Emergency studies must follow special rules. Before we do the study, we must make sure community members like you know about the study and see what the community thinks about it. This is one way for us to do that. For more information, please visit our website at www.lightsnetwork.org/CAVALIER.